Was called Aphasia in patients after a brain tumor resection, and it was conducted by a team of speech-language pathologists from MD Anderson Cancer Center. The treatment of this article is based on the severity of aphasia, and it's important that clinicians understand that the acute presentation of the aphasia after the surgery helps in directing which way the therapy will go. Oftentimes, therapies can consist of conversational coaching as well as supportive conversation, and sometimes SLPs are considered as counselors for the patient and the family members. The prognosis for long-term recovery is generally worse with patients with a brain tumor because they have greater potential of the brain tumor reoccurring and also have a lower survival rate. People who might benefit from this article are patients with a malignant brain tumor who have aphasia after that, or diagnosed with aphasia after that, and then also SLPs who are treating patients with aphasia after a brain tumor. I found it interesting because my fiance was diagnosed with aphasia after the removal of a brain tumor, so I could really relate. Um, the hypothesis that was conducted was that a tumor resection and a stroke located in the same region result in the same subtype of aphasia and can be treated the same way. And so how they conducted this, they conducted a study, and how they conducted the study, they took 63 patients who were all right-handed and all had a malignant brain tumor located in the left hemisphere of their brain. And then they were evaluated by a speech-language pathologist within 7 days of their surgery to determine what type of aphasia they had and then what plan would benefit them. So to conclude their findings, typically the aphasia in patients after a brain tumor was removed was mild, and they also found that acute postoperative language functioning may be fundamentally different with patients with a brain tumor compared to patients with a stroke. So, what are some strengths? They um, further understand they get a better understanding of acute language functioning after resection of a malignant brain tumor. And then limitations were their size, so they could have used more patients. I think, to sum it up, a personalized treatment plan for aphasia is very important. Most patients vary with the severity. They can start off global and then end up with anomic. So they're constantly changing, and I think that that's very important. And one thing I would like to know is more statistics about the correlation between subtypes of aphasia and the location of the lesion.